It is a sad truth that any health crisis will spawn its own pandemic of misinformation. In the 80s, 90s, and 2000s we saw the spread of dangerous lies about AIDS, from the belief that the HIV virus was created by a government laboratory to the idea that the HIV tests were unreliable, and even the spectacularly unfounded theory that it could be treated with goat's milk. These claims increased risky behavior and exacerbated the crisis. Now, we are seeing a fresh inundation of fake news, this time around the coronavirus pandemic. From Facebook to WhatsApp, frequently shared misinformation include everything from what caused the outbreak to how you can prevent becoming ill. At worst, the ideas themselves are harmful. A recent report from one province in Iran found that more people had died from drinking industrial-strength alcohol, based on a false claim that it could protect you from COVID-19, than from the virus itself. But even seemingly innocuous ideas could lure you and others into a false sense of security, discouraging you from adhering to government guidelines, and eroding trust in health officials and organizations. There's evidence these ideas are sticking. One poll by YouGov and The Economist in March 2020 found 13% of Americans believed the COVID-19 crisis was a hoax, for example, while a whopping 49% believed the epidemic might be man-made. And while you might hope that greater brainpower or education would help us to tell fact from fiction, it is easy to find examples of many educated people falling for this false information. Just consider the writer Kelly Brogan, a prominent COVID-19 conspiracy theorist. She has a degree from the Massachusetts Institute of Technology and studied psychiatry at Cornell University. Yet she has shunned clear evidence of the virus's danger in countries like China and Italy. She even went as far as to question the basic tenets of germ theory itself while endorsing pseudoscientific ideas. Even some world leaders, who you would hope to have greater discernment when it comes to unfounded rumors, have been guilty of spreading inaccurate information about the risk of the outbreak and promoting unproven remedies that may do more harm than good, leading Twitter and Facebook to take the unprecedented step of removing their posts. Fortunately, psychologists are already studying this phenomenon. And what they find might suggest new ways to protect ourselves from lies and help stem the spread of this misinformation and foolish behavior. Information overload. Part of the problem arises from the nature of the messages themselves. We are bombarded with information all day, every day, and we therefore often rely on our intuition to decide whether something is accurate. As BBC Future has described in the past, purveyors of fake news can make their message feel truthy through a few simple tricks, which discourages us from applying our critical thinking skills, such as checking the veracity of its source. As the authors of one paper put it, when thoughts flow smoothly, people nod along. Aaron Newman at Australian National University, for instance, has shown that the simple presence of an image alongside a statement increases our trust in its accuracy, even if it is only tangentially related to the claim. A generic image of a virus accompanying some claim about a new treatment, say, may offer no proof of the statement itself, but it helps us visualize the general scenario. We take that processing fluency as a sign that the claim is true. Gordon Pennycook, a leading researcher into the psychology of misinformation at the University of Regina, Canada, asked participants to consider a mixture of true and false headlines about the coronavirus outbreak. When they were specifically asked to judge the accuracy of the statements, the participants said the fake news was true about 25% of time. When they were simply asked whether they would share the headline, however, around 35% said they would pass on the fake news 10% more. It suggests people were sharing material that they could have known was false, if they had thought about it more directly, Pennycook says. Like much of the cutting-edge research on COVID-19, this research has not yet been peer-reviewed, but a preprint has been uploaded to the PsyArchive website. Perhaps their brains were engaged in wondering whether a statement would get likes and retweets rather than considering its accuracy. Social media doesn't insensitivize truth, Pennycook says. What it insensitivizes is engagement. Or perhaps they thought they could shift responsibility onto others to judge. Many people have been sharing false information with a sort of disclaimer at the top, saying something like, "I don't know if this is true, but..." They may think that if there's any truth to the information, it could be helpful to friends and followers, and if it isn't true, it's harmless, so the impetus is to share it, not realizing that sharing causes harm too. Whether it's promises of a homemade remedy or claims about some kind of dark government cover-up, the promise of eliciting a strong response in their followers distracts people from the obvious question. This question should be, of course, is it true? Override reactions. Classic psychological research shows that some people are naturally better at overriding their reflexive responses than others. This finding may help us understand why some people are more susceptible to fake news than others. Researchers like Pennycook use a tool called the Cognitive Reflection Test, or CRT, to measure this tendency. To understand how it works, consider the following question. Emily's father has 3 daughters. The first 2 are named April and May. What is the third daughter's name? Did you answer June? That's the intuitive answer that many people give, but the correct answer is, of course, Emily. To come to that solution, you need to pause and override that initial gut response. For this reason, CRT questions are not so much a test of raw intelligence, as a test of someone's tendency to employ their intelligence by thinking things through in a deliberative, analytical fashion, rather than going with your initial intuitions. The people who don't do this are often called cognitive misers by psychologists, since they may be in possession of substantial mental reserves, but they don't spend them. Cognitive miserliness renders us susceptible to many cognitive biases, and it also seems to change the way we consume information and misinformation. When it came to the coronavirus statements, for instance, Pennycook found that people who scored badly on the CRT were less discerning in the statements that they believed and were willing to share. Matthew Stanley, at Duke University in Durham, North Carolina, has reported a similar pattern in people's susceptibility to the coronavirus hoax theories. Remember that around 13% of U.S. citizens believe this theory, which could potentially discourage hygiene and social distancing. 13% seems like plenty to make this virus go around very quickly, Stanley says. Testing participants soon after the original YouGov Economist poll was conducted, he found that people who scored worse on the CRT were significantly more susceptible to these flawed arguments. These cognitive misers were also less likely to report having changed their behavior to stop the disease from spreading, such as handwashing and social distancing. Stop the spread. Knowing that many people, even the intelligent and educated, have these miserly tendencies to accept misinformation at face value might help us to stop the spread of misinformation. Given the work on truthiness, the idea that we nod along when thoughts flow smoothly, organizations attempting to debunk a myth should avoid being overly complex. Pennycook suggests that social media networks could nudge their users to be more discerning with relatively straightforward interventions. In his experiments, he found that asking participants to rate the factual accuracy of a single claim primed participants to start thinking more critically about other statements, so that they were more than twice as discerning about the information they shared. In practice, it might be as simple as a social media platform providing the occasional automated reminder to think twice before sharing, though careful testing could help the companies to find the most reliable strategy, he says. There is no panacea. Like our attempts to contain the virus itself, we are going to need a multi-pronged approach to fight the dissemination of dangerous and potentially life-threatening misinformation. And as the crisis deepens, it will be everyone's responsibility to stem that spread.